Thank you so much for joining us to learn more about the ARPA funding opportunity number 2 and our continued support for school-based dental sealant programs. This presentation serves as a simple guide for completing the application for this opportunity, though all applicants are strongly encouraged to carefully read and follow the RFA as written when completing their application. So what is ARPA funding? ARPA is an acronym that stands for the American Rescue Plan Act, instituted in 2021, which delivered $350 billion to states, territory, local, and tribal governments across the country to support their response and recovery from the COVID-19 pandemic. In 2022, the Medicaid Dental Services Program was awarded $2.6 million to support grants to rebuild and expand school-based dental sealant programs for the purpose of increasing the number of school-age children and youth with dental sealants. As was noted earlier, this is our second funding opportunity. Our first funding opportunity ended earlier this year. So why school-based dental sealant programs? Dental sealants are an evidence-based approach to preventing tooth decay in molar teeth where most cavities occur. On average, dental sealants are underutilized, with less than half of United States school-age children and youth having at least one sealant. And unfortunately, Nevada data is really no different. Evidence shows that school sealant programs are an efficient means to deliver these effective preventive services. So some general information about this current funding opportunity. It's one-time awards up to $70,500. We will be making reimbursements to our grantees as the method for making payments. Existing school-based programs should plan to expand to new schools and/or additional grades. New school-based sealant programs should be planned to be operational by January 15th, 2024. And as similar to our first funding opportunities, programs serving rural dental health professional shortage areas and Title I schools will receive additional consideration. So who may apply for funding? Nevada health districts, community and nonprofit organizations, FQHCs and community-based clinics, Medicaid dental service providers, public health endorsed dental hygienists, school-based health centers, educational institutions, school districts and schools, other licensed providers, and our previously funded ARPA grantees. So what may the funds be used for? Here's the categories which are included in the RFA. Also included in the RFA are examples of different types of equipment, supplies, and materials that should be included under each one of these specific categories when considering what funding you need and developing your budget. So let's review the application. These are each of the components that I'll be going in detail about. And again, in the RFA, this is clearly described as well. The first component is the cover letter, which is attachment A, and it is included in the RFA. In attachment A, we're asking for basic program information as well as contact information. We're also asking for a Nevada vendor ID, a unique entity ID, and an EIN number. If the application or the applicant does not have each of these three numbers at the time the application is placed, it is no worry, but they will be needed if the application is funded and prior to coming to receiving an agreement with the state for this funding. We do encourage you to review the RFA There are links included within it, which will give you information on how to access each of these varied numbers. Also, as part of the cover letter or attachment A, will be required signatures. And for existing school-based programs, we need you to complete the chart that's listed on here and also included as part of attachment A. The scope of work is really the main component of the application. In the scope of work, we need you to provide information and data on the unmet oral health needs of the children and/or youth in the service area where you're considering or proposing to provide school-based sealant program services. We need you to describe the activities that you will be conducting to increase the number of students receiving sealants, fluoride varnish, and referrals to a dental home. As an example, we need to understand who you're collaborating with, perhaps, where and when the consent forms will be distributed, where any promotion will take place and when that will occur. Perhaps you're going to be attending back to school nights. Maybe there's some information that's going to go out in a school's newsletter about the program. Also, when will you be providing those services? When will you be doing screenings? In what order will you be providing fluoride varnish and sealants? If this is a new school-based sealant program, we need you to describe in detail the activities that you plan to complete in order to be operational by January 15th. Also in the scope of work, we need you to describe the expanded or new school oral health preventive services, sealants and fluoride, you'll be providing with the assistance of the ARPA funding. Specifically, we need you to address school-based sites where the oral health preventive services will occur. We need to know if each site is new or existing, and or if the student population at the existing sites is expanding. As an example, if you're already providing services to second graders, but you're going to be expanding services to, say, sixth or seventh graders, please include that information in your application. We also need you to identify which schools are classified as Title I and or serving children with 50% or more eligibility for free and reduced school lunch. You'll find the table located here on this screen included as part of the application or the RFA. Please feel free to expand upon this with either columns or rows in order to complete your proposed expansion or implementation of a new program. Finally, the scope of work needs to describe how the equipment and or supplies you are asking to purchase with the ARPA funding will enable you to expand the delivery of dental sealants and fluoride varnish to increase the number of students being served at the school-based site. Please remember that this information should align with the proposed budget as well as the purpose of this program. We also need you to include a timeline. Please identify for us how you plan on implementing the expanded or new school-based dental sealant program. What month will the consent forms? What month and when will you be hiring new personnel if that's part of your program? When will sealants be applied? Also, please include when sealant retention checks will be occurring. We need you to include at least 2 SMART objectives that are specific to the purpose of the school-based program, increasing the number of students with dental sealants. If you don't know about SMART objectives or need to become more familiar, at the bottom of the screen, there's a URL which will connect you to the Centers for Disease Control and Prevention and their information on how to evaluate programs. Very clearly and informed information about how to develop a SMART objective. SMART is an acronym for specific, measurable, attainable, relevant, and timed based. Each of these objectives that we're asking you to create should be student population focused and must include a current base percentage or number so that intended change is clear and measurable. These objectives may be used in order to report back on the results of the work that you're doing. On the right-hand side of the screen, you'll see some examples of SMART objectives in green. I'm going to read the first one and review it. The remaining two you can do on your own. By March 2024, at least 400 seventh graders will be screened for dental sealants and receive fluoride varnish, compared to no seventh graders screened in school year 2022-2023. First, this is a SMART objective. It's specific. It's measurable. We see the number that we're looking for, 400 seventh graders. It's attainable. It's relevant based on where the funding and the focus of the program is, and it's timed by March 2024. This objective looks to be specific to either a new program, since no seventh graders were screened the year before, or a program that will be expanding, again, because no seventh graders were screened the year before. Please take the time to review the other two green SMART objectives. You'll also notice a statement in red. This is not a SMART objective. It's more an activity. Consent forms will be distributed to the elementary schools in Mineral County. It just describes what the program will be doing in order to implement and get it running. So again, if you have any questions about SMART objectives, once you've reviewed the CDC's website, please feel free to get in touch with us. The next two components in the application are workforce and sustainability. We'd like you to describe the experience of the applicant organization or agency to provide school-based services. We also need you to describe the proposed expertise and skill of the workforce, both existing and to be hired, to deliver expanded or startup school-based sealant program services. As far as sustainability, we need you to describe a plan for keeping the new sealant program or the expanded portion of the existing school-based sealant program moving forward in future years once our funding has ended. So, for example, will you be relying on Medicaid reimbursement? Will it be grant funding? Perhaps maybe you have a philanthropy that continually provides funding to your organization. Also, if you're including personnel as part of your budget and you're requesting it specifically for new personnel, we need you to describe how those positions will be maintained once the ARPA funding has ended. Finally, please note that ARPA funds may not supplant current funding for existing personnel, and you'll note that this is explained in the RFA. So on to the budget. Again, as a reminder, it may not exceed $70,500. We ask that you use attachment B, which is included in the RFA. The funds requested should be directly related to those items needed or included in the school-based program, and that you've described in your scope of work, timeline, and workforce in order to increase the number of children receiving dental sealant throughout the state. You may also submit a supplemental budget. This is in addition to the primary budget of up to $70,500. The supplemental budget may be no more than an additional $70,500. Please follow the same guidelines as the primary budget. And we'll ask that you identify attachment B if it's a primary budget and the supplemental budget, so that we're knowing what we're reviewing. We are not guaranteeing funding for the supplemental budget, even if you are funded for a primary budget. As part of the budget in attachment B at the very bottom, you'll notice a line item for indirect costs. Indirect costs are optional. They are not mandatory. But for those applicant organizations that have an existing negotiated indirect cost rate agreement, please include a copy of the agreement with the application. For applicant organizations that do not have an existing negotiated indirect cost rate, your indirect charge may be no more than 10% of the direct charges outlined in the budget. Also, the direct costs plus any indirect costs included in the budget may not exceed $70,500. If you have any questions about indirect costs, please contact us. The budget justification will be a narrative explanation for each of the line item costs that ARPA funds are being requested for on attachment B. They need to match what's each cost item that's been included on attachment B or the budget form. We need to understand as part of the justification how your budget cost items were calculated, and it should clearly refer to the school-based sealant program project described in the scope of work, the timeline, and the workforce. The indirect costs must also be described, and if you are submitting a supplemental budget, you will also need to supply us with a supplemental justification. So please take a look to the right-hand side of the screen. Here's a brief example or a snippet of what a justification might look like specifically for the line item titled equipment. The equipment in total on the budget form was $18,021. There's a narrative description that they'll be hiring 2 dental hygienists, expanding the program to serve 2 additional schools, and then 4 more schools in future years. It's referring back to the scope of service and the workforce sections of the application. Also notice that the $18,021 is broken out with each piece of equipment that's being requested. So you'll notice that they didn't combine Dental Works equipment for $12,000 plus. They outlined each specific piece of equipment. That's what we need each in the budget application to do. Notice the 2 ultralight patient chairs. It's a total of $3,326, but we can see here that each chair is $1,663. So please use this as an example of the detail that we're looking for in regards to the budget justification. Also note that we're asking for the information in the budget and the budget justification for what you're requesting for ARPA funds. We're not looking for information in regards to the total program costs, but we do need to have details on what you're asking for the ARPA funding to cover and specificity for each category. For new programs, we need you to include 3 letters of support with the application to document support for the establishment of your school-based program. Some examples of where those letters of support could come from include organizational leadership, the school districts, the school principal or school nurse where you're proposing to provide services. So just to review a few expectations of our grantees, all grantees must be enrolled in the system for award management. That is that unique entity ID that we discussed earlier. All grantees must be vendors of the state of Nevada through the Office of the Comptroller, and also grantees must have an EIN number. Again, these are those 3 numbers that you don't need at the application, but you will need if funded in order to come into an agreement with the state. All new school-based dental sealant programs must be operational by January 15th. This is a reimbursement grant, so invoices will be submitted no more than monthly following a stated deadline that we'll provide to our grantees. And final invoices must be received no later than Wednesday, May 22nd, 2024, to ensure your final payment. Funded programs are required to provide regular data and updates, including information about program expansion, performance, and sustainability. So let's talk about the reporting requirements. Attachment C is included in the RFA. It includes information on the quantitative and qualitative reports that we're looking for school years 23-24 and ending in school years 27-28. Again, those SMART objectives that you included in your application may be used as part of the reporting. Please refer to attachment C for more information about the information that we're requiring. And also the semi-annual reporting dates would be the end of December and the end of June. The annual reporting is due at the end of June. In summary, primary funding requests may be up to $70,500. Please remember the focus of this funding is to increase the number of school-aged children and youth with dental sealants. The application should include all applicable components outlined in the RFA. Your application should be no more than 10 pages. That does not include the budget and the justification. The application should be submitted in 12-point New Times Roman font. And the application deadline is Friday, October 6th, 2023 at 5 p.m. We do ask that you submit the application electronically to dental@dhcfp.nv.gov. All of this information specifically about the application and creating the application can be found in the RFA. Any questions? You may submit to dental@dhcfp.nv.gov. And again, thank you so much for joining us today, and we look forward to receiving your application.